Inflammation is the body's defense system, but it is a double-edged sword. Diet is the maestro controlling both your oral and intestinal microbiome. I'm Dr. Maria Florou, and this is Mind Your Mouth. I'll be sharing with you the truth about oral health that most people completely overlook. If you're ready to go beyond the basics, challenge the myths, and truly transform your well-being, let's get started. Welcome back to Mind Your Mouth. Let's start with something big today. What if your mouth wasn't just for smiling, eating, and talking, but also for messaging the rest of your body? Yeah, you heard that right. Today we're diving deep into one of the most revolutionary concepts reshaping medicine and dentistry, the oral-gut axis. This fascinating connection explains how your dental health, gut health, and even your brain are all intertwined. Whether you're a patient or a dental professional, or just curious about how your body really works, this episode will change the way you think about your mouth. And if you find this fascinating, make sure you share this video with your dentist because this is the future of personalized care. Did you know that your body is a host to trillions of microorganisms, tiny living residents who help run almost every system in the body? Together they call the human microbiota. Your mouth, believe it or not, is home to around 2,000 different species of bacteria, fungi, and viruses, and even some parasites sometimes can live there. In a healthy state, this community is symbiotic. It keeps the mouth clean, balanced, and resilient. And just past the mouth lies its partner ecosystem, the gut microbiome. The gut's microbiome is the most powerful bacteria group in the whole ecosystem. In harmony, this microbiome regulates digestion, metabolism, immune response, and inflammatory balance. But when that harmony breaks, when the microbiome balance is disrupted, we enter a state known as dysbiosis. Think of it as a civil war inside your microbiome. Dysbiosis isn't just a problem for your teeth or gums. It can ripple outwards, influencing everything from cardiovascular health and even your aging process. Things like Alzheimer's also get affected by the oral microbiome. So how exactly does your mouth communicate with your gut? Scientists have identified 3 clever biological channels of communication. One is the microbiome translocation. This is the physical migration of microbiome. Every time you swallow, billions of oral bacteria travel down the esophagus into the GI tract. Some do more than just pass through. They colonize, influencing the gut's microbiome balance. Elderly populations show fascinating evidence of this link. Studies reveal that the microbiome under the gum line in older adults resemble the gut microbiota far more than in younger people, showing that the oral health directly affects the gut biology with aging. The second one is immune modulation. The mouth doesn't just send bacteria, it sends messages to your body. Oral bacteria teach the gut's immune system how to respond, training the immune cells and cytokines in a delicate conversation between 2 different tissues. The third one is metabolic crosstalk. The microbiome in your mouth produces biochemical signals that metabolites like short-chain fatty acids, which have profound effect once they reach your gut. These act like hormonal messengers, fine-tuning digestion, inflammation, and even systemic metabolism. So essentially, the mouth and gut are talking continuously, biologically, chemically, and immunologically. Most microbiomes are helper, but occasionally the villains show up, like Prophyromonas gingivalis, a star villain of periodontal disease. They just don't cause just gum inflammation. They also sneak into your digestive tract, triggering inflammation and even showing up in the brain tissue for people that have dementia or Alzheimer's. Then there is the Fusobacterium nucleatus, which we know that's closely related to colorectal cancer and some forms of oral cancer. This inflammation is helping tumors grow. And of course, the classic Streptococcus mutans, which is one of the most common bacteria that we see in the mouth. And these type of bacteria influence dysbiosis, and increases the risk of heart problems. So when these bacteria migrate, they can change your microbiome and ultimately change your fate. Now let's look at one of the game changers of this whole scenario. And it is your diet. Microbiomes are shaped by your environment, and the biggest environmental factor is what you put on your fork. Diet is the maestro controlling both your oral and intestinal microbiome. Let's look at the good and the bad and the transformative. So diet high in sugar and refined carbs feed acid-producing bacteria such as Streptococcus mutans, leading to demineralized enamel and long-term issues. Add in high fat or ultra processed foods, and you've created a breeding ground for inflammation. High fat diet reduces beneficial bacteria like bacterolytes and SCFAs, biochemical protectors that keep your gut calm. Losing them means losing protection against periodontal disease and bone loss. Even diets having animal protein can shift the oral and gut microbiota towards protein degrading bacteria such as Fusobacterium and Clostridium, which are associated with inflammation and metabolic strain. So what should we really focus on? Fiber is your hero here. Indigestible plant fiber feeds your gut bacteria, and in return, they produce natural anti-inflammatories that help regulate immunity and metabolism. Communities with naturally high fiber diets, like many rural populations, show lower rates of obese people, inflammatory bowel disease, and even metabolic syndrome. So, yes, your plate is a health shaping machine, and you should seek personalized care for you, for your gut, and for your mouth. Now, let's talk about prebiotics, probiotics, and phytochemicals. We can actively nurture oral gut communication through functional nutrition. Prebiotics are non-digestible compounds that feed the good guys, the beneficial microbiome that you want to have. They help increase SCFAs production and create a more peaceful ecosystem. Probiotics are the living microorganisms themselves, like lactobacillus and bifidobacterium species. Unlike prebiotics, they temporarily colonize and can meaningfully shift microbiome balance. For dentists watching this, probiotics aren't just a gut story. Certain oral probiotic strains can reduce plaque, prevent cavities, balance saliva pH, and even help patients struggling with halitosis. And then we have phytochemicals, powerful compounds found in plants like green tea, grapes, cranberries, and berries. Take resveratrol for an example from grapes. It's been shown to enhance microbiome diversity and metabolic resilience. The combination of prebiotics and probiotics is known as symbiotic and advanced form of microbiome therapy. But remember, the regulatory landscape is still evolving on this. Supplements in this field aren't FDA regulated, so professional guidance is essential before choosing any of these products. Now, here's the part most people don't realize. When the oral gut axis goes off track, the fallout can be widespread. Dental caries begin in the oral cavity with acidic bacteria overwhelming the protective mechanism and enamel starts breaking down. Periodontal disease is another form of microbiome imbalance with pathogens like Prophylomonas gingivalis that and Treponema denticola, the infamous red complex, fueling chronic inflammation and tissue disruption. And researchers are now finding oral dysbiosis in early stages of oral cancer, like squamous cell cancers inside the mouth. Chronic inflammation driven by microbes like Fusobacterium that we've mentioned before may promote tumor development, and we're seeing that more and more coming up on the studies. But the mouth isn't the end point, it's the launch pad. These bacteria translocate, entering the bloodstream and colonizing distant organs. In the gut, Dysbiosis connects directly to inflammatory bowel disease, including ulcerative colitis and Crohn's disease. Oral bacteria are also often found in the intestines of IBD patients, indicating periodontal inflammation can aggravate intestinal disease. So we see this across the board. A lot of studies are showing this. Animal studies even show that saliva from periodontal patients with gum disease, can worsen colitis. An astonishing demonstration of mouth to gut pathology connection. And then there's the link with atherosclerosis, or bacteria found inside the artery plaques, and rheumatoid arthritis, where traces of oral microbiome are discovered inside the joints. The message is clear. Oral bacteria don't stay put. And once they move, they can alter your immune system in ways that trigger chronic disease. So what ties all this together? One word: inflammation. Inflammation is the body's defense system, but it is a double-edged sword. When short-lived, it's protective. When chronic and unresolved, it becomes destructive for the body. Chronic inflammation and dysbiosis feed each other in a loop. Inflammation alters microbiome environment, and microbes in turn perpetuate the inflammation. And we see these strongly related with things like Alzheimer's. I've mentioned this in other episodes, how Alzheimer's and periodontal disease play a role on one another. This doesn't just mean suppressing inflammation is the key, but teaching the body to actively shut it down. So the future of holistic care means restoring peace where chronic battle rages. So the oral gut axis represents a paradigm shift in healthcare thinking. We're moving away from treating isolated organs towards understanding the body and one continuous ecosystem. Imagine this future: dentists and doctors collaborating to assess your microbiome profile, identifying whether oral dysbiosis may be promoting systemic inflammation, metabolic imbalance, and neurological risk. By decoding your microbiome fingerprint, we could design personalized treatment plans, tailored diets, targeting probiotic combinations, and even microbiota-based diagnosis to restore, maintain, and balance across the oral gut pathway. Of course, research is still needed to bridge the gap. We need longitudinal studies that follow the same individuals over time, tracking how oral and gut microbiome play a role on each other. I saw a patient the other day in the practice, and she came to me thanking me for the life transformation that she's recently had. She's been my patient for many years, and she came in the last year, I would say, complaining of a lot of diarrhea. So she's been saying, Maria, I can't leave the house. I'm having a lot of problems with diarrhea, and anything I eat does not stay in my body. My iron is very low. I've got a lot of issues going on. I go to my doctor and nothing changes. I've done everything I could. I changed my diet and everything. So we did collect a sample from her and put it in the microscope. When we looked, she had massive dysbiosis on her oral plaque. What I did then, I recommended some oral care with the protocol that we follow in our practice. And then I sent her to see a dietitian because I knew that she needed to work on her diet and understand what was happening with her bacteria better. When she came back 3 months later, because I wanted to do a 3-month follow-up with her, she was so grateful. She's like, I was really at a crashing point. I couldn't deal with my life anymore, just couldn't leave the house, couldn't go anywhere, needing a bathroom wherever I would go. And now that is different. I felt really touched by her comment. I felt very happy that this is an opportunity that we have in our hands to help our patients. So if you're watching this and you want to send this video to your dentist, and if you are a dentist, you can connect with me through my LinkedIn account. I'm going to put my LinkedIn down on the comments below so you can get in touch with me, and I'm preparing something very special for you. So what is the takeaway here? We can't treat our patients in an isolated manner. We can't think that what's happening in the mouth is completely disconnected from what's happening in the rest of your body. Thank you for tuning into Mind Your Mouth. These episodes have been created for you. If you found this conversation helpful, the best way to support the show is by leaving a 5-star review on Apple Podcasts and Spotify. And don't forget to subscribe on YouTube so you never miss an episode. For more tips on holistic dental health, follow me on social media at Casuarina Dental. In the meantime, take care of your smile, take care of your health, and I'll see you in the next episode.